Welcome to all you storm watchers, storm chasers, and Leanierologists out there. Welcome to another edition of Tempest Talks, where we apply lean principles and philosophy and tools to our everyday lives and to our businesses. Today, our special guest is Cassandra Cannon, Dr. Cassandra Cannon. We are excited to have her discuss with us all of appropriate goal setting for the new year. This being the end of the year, a lot of us are thinking about New Year's resolutions and so forth. And if you're like me, you fail. So we're going to try to learn how not to fail this time. Well, as by way of introduction, Cassie is a licensed clinical psychologist and has her own private practice called Cannon Psychology. Prior to launching her own practice, she worked in multiple settings, including inpatient psychiatric treatment and resident treatment for substance misuse disorders. Her current practice focuses on treating survivors of trauma, and her favorite treatment modality is EMDR. I would love for you to explain a little bit more about what EMDR is as well.
Oh, well, now that's a problem because I could go for like 2 hours on talking about what EMDR is. So EMDR stands for eye movement desensitization reprocessing. You don't need to know what it stands for, but the purpose of EMDR is to help you take memories that have been stored incorrectly in your brain and still have a lot of energy and charge behind it. The purpose is to help your brain reprocess that memory so that the memory no longer feels like it just happened to you. It's just something that happened 10 years ago or 20 years ago or what have you. So it's not like you forget what happened to you. It's just that it doesn't have the energy that it once did. So people can usually talk about their past trauma without feeling intense emotion. It's just, a lot of people say that it feels like it happened to someone else. Or it's like a movie, I don't have the energy anymore. So, and I've used this from anything from, being nervous about talking in front of groups to kidnap and torture victim survivors.
Wow.
So it's a very helpful modality. I do need to say though that I was very skeptical of EMDR when I first heard about it. So I had to humble myself and change my mind once I realized that it was really helpful. And now that's actually all I do.
That's amazing. I've heard a lot about it, and that people really do, in essence, kind of detach themselves from the trauma. It's kind of amazing that our brains can do that.
Yeah. And the most common reaction I hear, usually a few weeks after we start finishing some EMDR targets. And when I say an EMDR target, I mean that car accident that you were in, that specific incident. Most people will say, I noticed that I was in this situation and normally I would have responded in this way, but I didn't feel that way anymore. And so it's more the things people notice don't happen to them anymore, which is pretty interesting to hear people come back and say, yeah.
Wow, that is interesting because, being a change agent, if you will, a change person within an organization, right? You're wanting to kind of help the organization get past some of the trauma that it may have been going through as well. What kinds of principles that work for EMDR? Because obviously you can't put everybody through the treatment program, but are there any situations that could actually work by asking certain questions or helping them get past the trauma?
Okay, so that's an interesting question because when you talk about that, I think about organizations that have gone through traumas like someone really important leaving the organization.
Huge.
COVID has been very strong upheaval. When it comes to EMDR, I don't know how much of it would actually apply to a system.
Oh, gotcha.
When I use EMDR, it's usually, if someone really struggles with authority figures because that was the perpetrator of their abuse. So then oftentimes it will be, okay, so we need to process that abuse so that you are no longer responding to your boss like your stepfather.
Yes.
Your boss isn't your stepfather. And
Right.
so administrators of organizations can shift their perspective a little in understanding that we all have past histories and we all view our world through these very personalized lenses.
Yeah.
And you and I can be in the very same situation and we can experience it very, very differently. I like to tell people about the time you and I were in Egypt.
Yes.
We'll do like a little sidebar here. Michelle and I were in Egypt together. We were in Cairo. We were right outside. Was it called the National? I can't remember.
Oh, the National Museum.
National Museum. And the tour guides and the bus driver were approached by the police, and we couldn't understand exactly what they were saying,
right?
Because it was not in my native language, but I did hear the word bomb a lot.
Yes.
And I remember turning to Michelle and going, should we be worried about this? And your response was, will it help? So we're in the same situation. I'm starting to get anxious, and Michelle, you're going, it's not going to help. So understanding that from a leadership perspective, that when someone is having a strong reaction to a policy change or to an interaction with an employee or a coworker, it's usually not about the policy change or the interaction. It's usually about what that triggers in their past, right? So often when I'm doing EMDR, once we work through like the very obvious past trauma, I'll say to people, okay, so over the next couple of weeks, I want you to start paying attention to when you start noticing that your reaction is stronger than someone else's reaction might be to something. Because that usually means this is hitting a trauma from the past. And trauma can be huge trauma, or it can be something like feeling invalidated or disrespected in third grade from your teacher. It can be something that doesn't seem very traumatic, but you can really experience it as traumatic. So I'll tell people, let me know how it goes the next few weeks, and they can come back to me and say, okay, so I really responded negatively to this situation, and then we go back and find the trauma that's underlying that. One thing I like to ask people to do is, if you're not sure if your reaction is stronger than someone else's might be, you need to find a trusted friend who can tell you the truth and you won't be upset with them. And you say, hey, this is what happened. How would you feel about that? And that helps you gauge whether it's something that anybody would have a strong reaction to, or if it's just your stuff. And then, okay, then we can work on that.
That's great.
So going back to the administration and the leadership level, rather than responding to your employees based on what's actually going on concretely in the moment, you can take a moment and go, there might be something else going on with this. And you can actually start to treat people a little bit differently based on what you know about them personally. So that's why it's really important to know your employees very, very, very well.
Yeah, that's an awesome point, because in the last few years, I would say HR has kind of made this transition from being HR into being an HR business partner, trying to help employees and managers understand that it's not about inflicting policy or procedure on people.
Right.
It's about learning your employees, what their strengths are, what their weaknesses are, and trying to help them develop out of that. Some employees are going to be great, and some are not. And if they're not okay, then maybe we, make opportunities to shift them around, maybe to a different department where they would be successful, versus leaving them where they are. So all of those kinds of things, I think is brilliant about mental health really starting to come into the workplace, where it was missing for decades. It's been missing.
Yeah. Well, and we spend so much time at our jobs.
Yeah.
It's, so if you're working at least 40 hours somewhere, most people are working more than that.
Yeah.
People at your work are your second family. So you get to know them really, really well. And that also means that your own personal dynamics can't get brought into the workplace.
Yes.
And so when you see someone behaving in a certain way, that helps you understand actually how they behave in their personal life too. Because you just bring those dynamics right back into the workplace.
Yeah. I think we all have situations where we're like, "Ooh, somebody woke up on the wrong side of the bed this morning."
But it could be that something that was said in the morning meeting really hit a nerve and they're in a trauma response. They don't even realize they're in a trauma response. They just feel like they're off.
Yeah, it's amazing. Yeah, I hadn't really thought about that before, but I'm so glad that, where the world is becoming more open to understanding mental health. It's not a disease that needs to be shunned. It's actually something that we need to learn about and support one another in.
Yeah, we all have something.
Yeah, all of us do.
We all usually have at least more than one something, but we all have something.
Yeah, we all got something. I remember a friend of mine telling me once that everybody talks about, because this was when, all of us were single, right?
Yeah.
All of us have baggage and, you've got to carry everybody's baggage and blah, 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 blah. And you've got to worry about the person getting rid of their baggage before dating you. And I remember this friend telling me, no, it's not baggage, it's luggage.
Yeah.
You support them in carrying the luggage, not get rid of the baggage like garbage.
Right.
And I remember thinking about that going, oh, that makes so much more sense. Because we're supposed to support each other, not judge each other on what our baggage is, because all of us have baggage, like you were saying.
And does your luggage match or not?
Yeah.
If your luggage doesn't match, it means that someone else's luggage will match them better. And that's okay.
Yeah, exactly. I liked how you were talking about talking to a trusted friend and seeing whether or not your behavioral response was similar to theirs, or if it's something that you may need to work on personally. I really appreciate that because, I've used you multiple times throughout my career where I'm like, so this kind of situation just happened today. What do I need to do? Is that normal? And I distinctly remember you telling me once, yeah, that's not normal. You might want to talk to somebody in HR about that because that's not normal. I distinctly remember that. But as we're thinking about, and it was with people that I was managing at the time. I don't know if you remember that one or not, but but what was interesting about it is we then started, thinking about what kinds of goals can we give this individual that's kind of like spiraling out of control. What kinds of goals can we set for them that make sense? Yeah. So do you have any advice for maybe a leader that's trying to set goals for the oncoming year to help each one of their employees succeed?
So I was thinking about that actually today, kind of going up to even a more broad perspective. Every company has a different culture.
Yeah.
And I actually was talking with one of my clients about this, like, what's your brand? As an employee showing up to work, what's your brand, or what do you want to present to the world? For me, when it comes to my clients, I want them to feel safe and validated, and also know that they won't be judged in any way. Some companies, they're really just going to value efficiency.
Yeah, true.
Other companies will have more of a balance of efficiency and morale and et cetera, et cetera. So I think the first thing that needs to always have a solid foundation is that culture in general, because if you don't have the solid culture and it's actually people actually feel that culture, then trying to bring in the yearly stuff is not even necessarily going to be the best place to start. You want to go back to the basics and make sure that your foundation is a nice solid foundation. When it comes to maybe like an annual set of I guess goals for the year, you're going to want to make sure that each of your employees feels included in some way, that one of their strengths is going to be used in this sense. Otherwise, you will have people feeling almost like defeated, that they can't really contribute.
Yeah.
And so as long as people feel like, oh, I can contribute in this way, I can, and sometimes people won't even be able to see it themselves, but if you are a leader that knows your employees, you can say, and Michelle, this is how I see you contributing in this way. And I think the biggest thing is helping people have a vision of the intention of the goals, not just that it's, you know, a checklist, but this is why we are doing this. Because we imagine what our company would look like if, kind of painting that picture of what things would look like.
I like that you mentioned like what's our brand, because one of the things that I talk about all the time through several of these Tempest Talks, as well as in any of my coaching sessions from a change management perspective, I always talk to them about something very similar, which is if the culture's not right and your branding's not right, if the culture's not right, you're never going to be able to make lasting change work. Because exactly like what you were saying, people are going to feel like they're left out or it's been inflicted upon them rather than it was their choice to participate in the change process. And so, I mean, we've all been there, especially if you've worked in corporate America, where at the end of the year, going into the next year, they give you your personal key performance indicators. And at the end of the year, they're going to tell you whether or not you achieved them or you didn't achieve them. I hated that time of year, not because I wasn't achieving stuff, because I was, but it was more like, this is that check the box, like you were talking about. And it's not really like helping my development. And then once you get into a management role and you find out, oh, we need 5% that are in the low and need development group, and we need.
You're like, ouch.
It's like, do we really need to like bucketize people in these?
I was lucky in when I was a clinical director, I did not have to have.
Hallelujah.
I did not have to have that. But when I was giving the feedback, I would say, okay, you scored a 3 out of 5 on this, and this is why.
Cool.
Give specific examples. And what I would prefer to see you working on in the future is, I think, specific examples. But that also helps that I was working at a rehab center that was run by psychologists. So that's how we do things.
Yeah, kind of helps. We understand the human brain, how it functions.
And people respond more to motivation.
Yeah.
And so when, rather than giving all of the negative, you really want to focus on the positives. And even with behavioral psychology and child development, we know that you want at least 5 positives for every 1 correction. And so you want to maintain, because that way, I like to tell people it's kind of like your bank account has credit in it. So to speak. This works in all relationships, whether it's personal or professional, making sure that there is that emotional credit there so that when there is a negative or a withdrawal, so to speak, it's not as painful.
Yeah.
And people hear it a little bit better.
Yeah, interesting. Would you say that there's a fine line between genuine feedback and critical feedback, because like I've received backhanded compliments before in a work setting. So how should we deliver negative feedback to someone?
So I would frame it more as constructive criticism and for opportunities for growth.
Okay.
More of that positive direction, and say, I would like to point out, these are the ways that you do this well.
Mm-hmm.
And in order for you to grow even more, here's the next step to that.
That's cool. And that goes along with goal setting too,
Mm-hmm.
right? Because we don't want to overextend the person's ability either. So we don't want to give them a goal that's totally unachievable.
Yep.
So how do you balance, the rapid growth of the company with where that employee is at that moment?
So you brought up you reminded me of a concept called learned helplessness. You may or may not have heard this before, but the concept of learned helplessness is when you try and try and try and fail and fail and fail, you end up just stop trying. And this was originally discovered, I don't even remember when, but they were doing these experiments, which would not be allowed today, but they're doing experiments with dogs in a cage. And every time the dog tried to leave the cage, it would get shocked.
Oh, yeah.
So then it would stop. And then they would leave the cage of the door open, but the dog wouldn't even try anymore because it had learned helplessness. So if you have a staff member that's not able to keep up with the rest of the company, you need to shift and change. In my head, it's like a treatment plan. You guys don't think of treatment plans, huh? You need to shift their performance improvement plan to something that's reachable. Otherwise, they will just give up. And that can, create a lot of problems, as I'm sure that you know. And so they might not be matching the rest of the company, but are they matching their own abilities? And, there's always is that possibility that they're just not the right person for the job and they need to be shifted or unfortunately let go. But I personally feel like if someone is doing the best that they can, then that is a reason to keep someone with you, because that's, in my mind, what's really important. So shifting it to just something that's just above the next level, and then just working your way up there rather than.
Makes sense.
Yeah.
And I think that's probably the intent behind performance improvement plans like PIPs and so forth. That's probably the intent behind them. So if done well, you should be able to see the employee actually thrive. If they're not done well, then you may see an increase in frustration or virtual exiting, if you will.
Yeah. I've also seen where people aren't living up to the expectations, and it's not because they can't. It's because they know that there's not any kind of consequence if they don't.
Oh,
and you may have seen this where then other people in the company start having to take on someone else's work to keep, if you have a bunch of people in a department and one or two of the people aren't really pulling their weight, everyone else has to kind of carry them.
Right.
And so when you see that there's no consequences for poor performance, and it's not, and they can perform, it's just that they're not. Then you see resentment in the entire company or department, and people get frustrated. Well, how come so-and-so doesn't get his report in on time? Well, because they know that so-and-so will do it for them.
Yeah.
So you really have to be paying attention to what really is going on. And if you don't know your employees very well, then you're not going to know. That's because so-and-so is taking over so-and-so's work.
Yeah.
And it turns into a big mess. So it is important also for your employees to have the accountability. if you've explained to them that they're not going to get a raise, or they're not going to get a raise as big as usual because they didn't get this certification that they needed, and then you don't do it, then they're not gonna. So you have to really hold people accountable.
Yeah, so it's kind of like a balance between a growth goal or a metric and this is a requirement for everyone kind of metric as well. So there should be a balance between the two. Yeah, interesting. And then as individuals, because we're end of a new year, or end of an old year, I should say, and beginning of a new year, a lot of us are setting New Year's resolutions as well, and I often fail because I am an idiot and I pick I'm going to lose 40 pounds or whatever it is, and it's totally not achievable, but it's a good goal to have, right? So what's a good individual balance for goal setting?
So something to remember, and I learned this a lot working with substance use and when people have slips or relapses, is yes, we can look at something as a failure, but that doesn't help us grow or meet our goals. But we can go, okay, we can reevaluate. Maybe my goal was a little too lofty, or maybe I didn't have the support that I needed to reach my goal, or maybe I didn't have all the information that I needed to reach my goal. And so you really want to evaluate, when you slip in your goal. So for some people, this might be they just had they ate a whole cake. Right. I might have done that before.
I have.
Rather than and giving up on your entire goal, that's very all or nothing, black or white checkbox.
Right.
That is an opportunity to reevaluate. Okay, so what can I learn from this lapse? Is it that whenever I feel really stressed and anxious, I'm really vulnerable to the cake? So each lapse is an opportunity to learn. And it may be that the goal is too lofty and we need to move it down to 10 pounds.
Right.
But it's going to be very unique, and everyone is so different that there's no one size fits all.
Yeah.
And so that's one of the ways that people really can meet their goals is getting very introspective and learning from each stumble rather than throwing the baby out with the bathwater.
Yeah, there's a lot of people that you and I know that really get frustrated with themselves when they do not achieve a particular goal. And it may just be because we've surrounded ourselves with very accomplished individuals that are very driven, and being driven can sometimes cause us to have these high expectations, if you will, or delusions of grandeur. And then we can be extra hard on ourselves when we don't achieve it. So how can we be okay, if you will, for those kind of like, I know I hate the phrase, but type A personalities? How do we help those folks realize that, 2 steps forward and 1 step back is still progress?
Step forward. Well,
how do you help them understand that?
What I would recommend is actually changing the goal from we're going to use weight, I'm going to lose 40 pounds, to I'm going to work out 3 days a week, changing it to goals that you can actually, it's your effort that actually matters, because everyone is so different. Maybe you can't lose the weight because there's some, something health-wise going on underneath.
Yeah.
Or maybe that's just not realistic for your body to lose 40 pounds. But you can switch it from I'm losing 40 pounds to I want to be able to lift 50-pound dumbbells for my bicep curls. I want to be able to run a mile without stopping, changing it more to those goals, because those are more achievable.
Yeah.
That's more in your control versus something that's not necessarily, some things just aren't in our control. And then we need to kind of shift what our goal is. So it's not, did you lose 40 pounds? It's, well, what, can you run a mile without stopping? That's really great.
That's awesome.
You know?
Yeah. And it is kind of like a treatment plan in therapy as well. Because I'd imagine, you know, it's not just one session of EMDR that gets a person through the trauma. It's gradual progress and really working through the situation with yourself internally.
Yeah. And it was interesting. I have a client right now who does a lot of work with yoga.
Oh, cool.
And one of the principles is go with what your body needs.
Oh.
And so rather than trying to force ourselves into what things should look like, maybe we shift more to what our body needs, what we need, rather than what some other, you know, someone else's standards of what those are.
Yeah, totally. Well, and that goes for large organizations too. You can only run so fast. You can't expect to be in the Fortune 500 in your first couple years. Like there's got to be incremental steps. It's the same sort of thing with our own private lives as well. And our relationships too. So maybe somebody has set a goal this year to become closer to an estranged parent. Something happened when they were kids, and you know, something happened. What would you recommend to someone who's trying to maybe repair a relationship that went bad for some reason, by no fault of like addiction or abuse or anything like that? Just something simple where they've kind of drifted apart. What kind of recommendations would you give for someone like that?
Well, so with a goal like that, you have to account for the fact that the other person has their free agency to decide if they want that relationship too.
Yeah.
And
true.
so you're going to have to shift your goals from we're going to have a close relationship to these are the efforts I'm going to make on my end, and whatever happens, happens. Something else to remember is not all relationships should be rekindled because they're not always healthy. So before even deciding to get close to that relationship again, you might want to really think about why.
Why do I even want that relationship?
Did we drift apart and it was just kind of something that happened? Or is it because this is not a healthy relationship for me? And so it's really important to make sure that it's healthy. And that is something that you often need to talk to a psychologist about.
Yes, for sure.
To have that be, because I won't tell someone if the relationship is healthy or not. I will ask questions and support them as they figure out for themselves
whether or not it's healthy.
There are times where it's very clear that it's not healthy, and I will say it's not healthy. But most of the time it's, having that conversation and figuring that out on your own time frame too.
Yeah, it's almost better that way. It did. Okay. Because it's almost better for them to go through that themselves anyway, because then they're never gonna regret the choice that they make to either pursue it or not pursue it. They won't regret it because it's been their decision. They worked through it.
I see this a lot because I work so much with abuse survivors that there's almost always the pull of, I would like to get close with so-and-so again. And there's always this question, and it often happens when like you're planning for a wedding or something like that. It brings up all of these dynamics, and each of my clients has come up with a different answer for them.
Interesting.
Some people will say, you know what, after just really thinking about it without pressure, I just can't have that person in my life. They're too dangerous. It's too unhealthy for my well-being. Other people will say, eventually I think I can, but I need to work some stuff out. And then other people say, no, I think that I can manage it. And then we work on how they manage that. So
Yeah.
it's that's actually a very common thing I work with almost every day is, well, do you want to reconnect with this person? Is it healthy? What does that look like?
Yeah.
So it's interesting you brought that up because I talk about it almost every day.
Yeah. Well, because I think it affects everybody every day, because it's not just our personal relationships where that can happen. It can be in our work relationships too. I mean, if you go into like behavioral health and organizational behavior and stuff like that, they talk about toxic workplaces. Guess what makes it toxic, right? It's the relationships that are toxic that make the work environment toxic. And so sometimes people have to remove themselves from a toxic workplace, not because the business is terrible or that the people are terrible. It's just the combination of certain people is terrible.
Right. You're right. It is, a lot of it is about the combination of people. I often talk with people about, Michelle, we'll do this together.
Okay.
What's your favorite flavor?
Of what? Ice cream?
Sure.
Chocolate.
Okay. So chocolate's really good. What goes really well with chocolate?
Vanilla.
Okay. So chocolate and vanilla, very good together. What does not go with chocolate at all?
Oh.
Which I know is hard. Onions?
Cheese.
Someone might argue that. Let's go with like onions. You're not
onions. Okay, that works.
Together.
Question:
yeah, that works. Do you like onions?
I do not.
Crap, I chose the wrong thing. But let's just say that you like onions.
Okay.
The point being is chocolate and vanilla go really well together, but chocolate and onions don't.
All right.
Something that goes really well with onions is like, pretty much like any protein, right?
Yeah,
we use onions a lot for protein. Well. So, you have the sweet and you have the savory. They're both excellent, but when you try to mix the chocolate and the onions, that's going to be really disgusting.
Yeah.
And there's nothing wrong with the chocolate and there's nothing wrong with the onions. It's that the chocolate and the onions don't belong together.
Yeah. Yeah. Yeah.
Sometimes we need to go, just this combination isn't good and there's nothing wrong with me. There's nothing wrong with the other person. It's just the combination doesn't work and we can be friendly acquaintances.
Yeah, which is awesome because I remember having an aha moment a few years ago where it was like, you know what? And this goes with a personal relationship as well as a work relationship, which just so happened to be at the same time. I realized that both relationships were not building me up. They were actually tearing my confidence down. And so I made the conscious decision, I'm out.
Yeah.
And it wasn't a big dramatic thing. I didn't have to make a huge statement about it. It was more, you know what? We're chalk and cheese, as they say.
Yeah.
We don't mix and it's okay. You can have this wonderful life without me and I can have a fabulous life without you and it's okay.
Yeah.
And it worked out really well. I think they're in both situations, I think the business is doing really well. And I also think that this friendship, ex-friendship, I should say, is doing really well as well. So we've got to celebrate that too, right? There was a recognition that something wasn't working.
Yeah.
And so who was the adult, right? Kind of a thing. Yeah. Like we talked about at Goodrich all the time, we had what we called the one rule, but there were actually like many rules within the one rule. But the ones that always stood out to me was open two-way communication,
Mhm.
adult to adult behavior, right? And so if I'm acting like an adult, I can always put myself as the bigger person. So a few years ago, a friend of mine was kind of dealing with some personal stuff, and I knew that they were dealing with some personal stuff. And this individual needed a punching bag for an afternoon. Whether or not that was the correct method, I told myself, I can be this individual's punching bag for the afternoon because I care about them more than I care about the situation. So I'm going to allow them to vent and let go and all of that, and I can move on. So that was adult to adult behavior. The method I wouldn't recommend, though. Don't go seeking to be people's punching bags. But you get what I mean.
Can I jump in about adult to adult behavior?
Yes, please.
This is one, and I don't know if I've ever talked to you about this, but this is one of the most helpful things I learned as a grad student that I tell almost all of my clients. Just because someone chronologically is in their 50s doesn't mean that developmentally, emotionally, that they're in their 50s. And something we know, I'm sure you've heard the phrase arrested development.
Yes.
We can get
my favorite TV show too.
Yeah, we can get stuck. So if child abuse started at 10, you will find that a lot of people revert to age 10 a lot because that's kind of where they got stuck and there's some unresolved stuff there. So when I'm interacting with people, I often am just kind of in my head gauging how old they actually are developmentally wise. And so if I know that I'm interacting with someone who's emotionally about 16 or 17, that's my expectations for them. My expectations is I'm dealing with someone who's 16 or 17 and they are capable of this, this, and this. And so that allows me to also not take offense because I know that I know their developmental level and what to expect. And so unfortunately, some people are not capable of the adult to adult interaction without a lot of coaching. And so as a leader, you may need to be able to, and I've actually done this before, like looked at emails back and forth and said, this is where this is a problem. Because people just need to be educated. They need to learn because they either weren't taught,
right?
Parents were 14, 15 years old too, emotionally. And so everyone can learn, just not everybody was taught. And so we need to be more patient with those people who need a little bit extra help in that area because they just don't know.
Yeah, that's an awesome way to look at it too. I don't know that us as leaders really do that quite often. And at least in industry, some of my experience has been the leader has expectations of how you're supposed to behave. And if you don't match their set expectations, then you're the one at fault.
Yeah.
And which is sad because they're not looking at the individual at where they're at, like what you were saying, at what age they're at. But there's lots of tools that can help them with that. One of those is like being a trained psychologist for one of those things, and understanding, the development of humans from that perspective. But there's also things like Myers-Briggs and realcolors.org, which is something that, I do.
I'm a gold.
To kind of, help with some of that. And a lot of leaders are golds. And leaders are, if they're a gold, as you know, because you've been through it as well, as a leader is in charge of things. Oftentimes, if they're a gold, they're looking at who told them that it needed to be that certain way. So they're looking at it from the policy and procedure standpoint, not from the human standpoint. So they need people in HR, in psychology, and in organizational behavior and health that are blues to help support them understand the human factor of it too. Having gone through real colors and other things like it, like DISC and Myers-Briggs, all of that good stuff, do you think those things are helpful to understand and communicate better?
It was helpful for me. Is interesting because I'm a gold with some, like my next one was blue.
Yeah.
And my husband's very much a blue.
Yes.
And so I'm often like, we gotta go, we gotta go, we gotta go. And it's helped me be a lot more patient. Even though I have the blue in me, I'm able to just kind of channel my blue a little bit more. But also is interesting seeing, because a bunch of us friends did it together, seeing the friends that were also gold.
Yes.
Like, no wonder we get each other. Yes. So it also helps understand why I felt connected with people, and then how I need to shift and maybe soften my stance with certain things to make the relationships with friendships, coworkers, colleagues, my husband, more harmonious for everyone.
Yeah, totally. It's so funny because I deliberately don't tell people what my colors are because they need to come through the class and determine for themselves what they think my color is. But what's interesting about it is, like you were saying, all our friends that are golds, there's actually quite a few of our core group of girls. I would say half of us are gold and half of us are, I would say a quarter is blue, and then the other is like a mishmash of everything else. But there were a few of us that were golds, and it was kind of like interesting to see the golds interact, because we did have one gold that was assigned with the blue group. I don't know if you remember this.
I don't. But, I can just imagining what it must have been like.
It was hilarious because when they're trying to work on their team effort and their team whatever it was, anyway, the blues are just trying to be peacemakers. So they're like, yeah, okay, that makes sense. Yeah, we can do that. And the gold is like, no, it needs to be like this, and it's got to be structured. And it's like,
this is what the rules say.
She asked us to do this, so we're going to do this, 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 and this. And the blues are just like, I'm not feeling comfortable with this, but we're going to be okay with like just making it work. It's really funny to watch because this gold individual was adamant that they were blue.
That's very gold.
Yes. It was so funny. And I think we do that to our staff, where we, based off of our preferences, our preference is to be whatever color we are, and we project that onto our staff, thinking that they're going to be the same color, and they're not.
Right. And one of the things you talked a lot about in that training was that each personality has its strengths and its weaknesses. And I actually, here's another conversation I have a lot with almost all of my clients, is the introverts and the extroverts.
Yes.
So many introverts have been shamed for being an introvert. And so just kind of shifting the perspective of something wrong with being an introvert. These are the benefits of being an introvert.
Right.
And kind of same thing with the colors, is we need all of the different colors to make the world go round. And so when we channel the strength of the colors, soften things for the weaknesses of the colors, you're going to have a lot more success.
I love that. I'm so glad you said that, because you're absolutely right. And when we're goal making and setting appropriate goals, we've got to come from the perspective of that person's preferences. It's not about all us, because there are going to be business preferences, of course, and there are going to be things that have to be achieved because it's a corporate thing.
Yeah.
But when they're personal development,
State law, federal law.
Yeah. But it's like when it's a personal goal or a development goal for the individual, it should be coming from the perspective of their preferences, not what's being projected upon them.
Yeah. And that's where you're going to see people be more successful. They'll be more motivated.
Yes. And how do you motivate people? Because you've mentioned that a couple times. Like, how do you actually motivate and build teamwork? How do you do that?
I feel like a broken record, but one of the most important things is to know your team well enough to know what motivates them. Some people really want acknowledgement and praise.
Yeah.
Other people want more like social connection. Other people just want to be left alone.
Yeah.
So you really need to know your staff and what motivates them. But I think one of the strongest motivating factors is when people know that their supervisor and administration actually care about them. They will be, and I've seen this in different scenarios where you'll have people who will go above and beyond because they know that they're appreciated. And then you have people, and I've had the same people not go above and beyond because they don't feel appreciated, or that their health is valued, or that their safety is valued. And so you have people who will just say, okay, so it's clear that I'm not important to you. I'm just a body in the chair to get this work done. And then people don't go above and beyond. So really, when people feel like, and when decisions are made on a case-by-case basis based on nuance, because not everything is the same, when people really feel like they're being looked at as a person and not just a cog in the wheel, people will go above and beyond. But one thing that does work for me when I know that there's personally something I need to do, but I don't feel the motivation in the moment, I will set a time period. Like, I'm going to, I'd had to do this a lot for my dissertation. I'm going to sit down for 20 minutes.
Yep.
And if after 20 minutes, I just don't have the motivation, I'll stop and I'll try again tomorrow.
Oh, good.
It also means you need to plan ahead too.
Yeah.
Right. But it really does make a difference if you go, I'm just going to act as if I'm going to try. And if after a period of time, I just am still not feeling it, then I'll give it a try tomorrow, because I'm sure you notice that there are going to be times where you have that extra motivation and times that you don't. And so don't try to force the motivation when it's not there. Gently nudge it. And if it's really not there, then give it a break and try tomorrow.
So how do you prevent yourself from procrastinating then?
Okay, so I'm a gold, so this might not be a good question for me. Some people, when it comes to goal setting, a lot of times I'll ask people, are you one of those people that does better like the night before? Because some people need the pressure.
Yeah.
And some people like me, when the pressure comes, I feel frozen.
Yeah.
So I was that nerd who would have like my paper done like the week before it was due, just because I don't do well with the pressure. And so what I would do myself is go, okay, so it's due here. Then I'd break everything up into smaller goals. And I'd be like, okay, so I need to get this done by this day, this done by this day, this done by this day. And that's how I would work it out. The days that I just didn't have the motivation, though, I would maybe move that one chunk to the next day. I don't know how procrastinators do it. You procrastinators out there, I don't know how you do it, because I get frozen and stuck. But some people do need that extra pressure, and they work better under pressure.
I'm terrible because I am a procrastinator. I'm a planner, but I'm also a procrastinator. So it's almost like I procrastinate up until the point where I know that if I don't start, the plan will go south.
I guess that's not too bad if you've plan though.
Yeah, I plan a little. But it
Well,
works out like when we're on trips, because if something goes wrong, I don't totally panic. It's
yeah,
like, oh, okay. I've got to figure out how to change it to do something else.
that's why I like traveling with you, Michelle.
It's
But
like,
but this does really help, particularly if one of your goals is to exercise 3 times a week. You
yes,
might not feel like it, but maybe you just start walking
yes,
or start running for 5 minutes. I'm going to run for 5 minutes and we'll just see how I feel. That tends to be really good for those specific things where you just don't know if you have the energy for it.
yeah, totally. Yeah, it's not like like what I kind of stupidly did. Um, go and run a Ragnar without any training. Go and run a half marathon without any training. I did that a few times. I don't recommend it.
Yeah,
It's
probably
bad.
doesn't feel good.
Try running for like 5 minutes without stopping, and
Yeah,
then
let's see how that goes.
gradually increasing the time.
Yeah.
It's so bad. Oh man, I've done that so many times, but it's true. And yes, folks, I am a lean efficiency professional. I do know better.
We don't always do what we know we're supposed to, though.
Exactly. And that's what makes us human, and that's what makes life so beautiful. Is that we are allowed to make mistakes and we can recover from them. It's a beautiful thing. That's, to bring it full circle, that's one of the reasons why I'm a huge advocate of EMDR as well, because what people don't realize is that trauma will continue to eat at you, and you don't even realize that it's eating at you. And what it ends up doing is it poisons your thoughts about yourself
Yeah.
in the situation. And EMDR is beautiful because it helps you break that traumatic connection and helps you recover and feel more positive and have more light in your life, if you will.
The words I hear a lot is I feel lighter, I
Mhm.
feel peace,
Yeah.
I feel strong. And I
Yeah.
think part of it is not only are you addressing the negative belief about yourself, but you're also then enhancing a positive belief like, I'm okay as
Yeah.
I am. I did the best that I could.
Yeah. And it's okay,
And it's okay.
because life is a race, yes, but it's a race with myself. It's not a race with my husband. It's not a race with my best friend. It's not a race
Yeah.
with anybody else.
Yeah.
It's a race against yourself.
Yeah. And also, full circle, mistakes are an opportunity to learn.
Yeah. Also,
Sometimes when we make a mistake, that means we need to acknowledge and make restitution and apologize.
Yeah.
But all of that is also part of the process of learning. And so really what matters is that you're a little bit better today than you were yesterday.
Totally. Well, Cassie, this has been a fantastic discussion. I really appreciate you taking time out of your busy schedule to meet with us and discuss these things, because I don't think enough of us, at least in industry, are talking about things like mental health and taking care of ourselves. Is there anything that we missed in our discussion that you want to share?
Just one thought that came up as you were saying that is for people to remember that if you're feeling anxious or if you're feeling depressed, you will be surprised how many people in your sphere of influence are actually feeling the same way. And so, we see this a lot in work situations where people feel really anxious about performance or meetings or presentations. And I think that rather than feeling like we need to hide it, I think that we can support each other a little bit better in that, because so many people feel like they're alone and they're the only person that's having a panic attack today about the meeting. And if we're a little bit more authentic with each other, that might really help not only you, but the other people around you who are also struggling as well.
That's awesome. Thank you so much for saying that, because it's so true. We need to take advantage of looking outward more. It's true, because we tend, especially when we're in trauma, right? We tend to close in. So it's always good to look out. That's why they always tell us at church, among other places, service. If you're feeling depressed, service, right? Yeah. Beautifully said. Thank you so much, Cassie. I really appreciate it. I always love talking to you. I love our travels. For those of you that have never met Cassie before, you're missing out. Usually this time of year, we're off shooting zombies with paintball guns. I mean, it's awesome. Cassie is one of my best friends, and I'm so grateful that she was willing to talk to us today. Thank you so much, Cassie. I hope you'll come back.
Thanks for having me anytime.
Fantastic. Well, thanks so much. And we'll see you on the flip side in 2022. Thanks so much. Bye.